severe acute malnutrition, and moderate acute malnutrition. I hope am I audible? Yes. Then starting with our presentation, in the this first session of this module, we will have introduction, then prevalence of malnutrition across the globe, conceptual framework, contributing factors, clinical effects, and the categories of malnutrition. Malnutrition. What does malnutrition refers to? It is basically the imbalance of nutrients in human body. And this condition encompasses both the undernutrition as well as overnutrition. Like if suppose a person is having deficiency of nutrients, doesn't have undernutrition, and if any person is having, someone is messaging, visible or not visible? The slides are not visible. Wait a minute. Are they visible now? Anybody in the chat box? Not visible. Wait a minute.
Yes, Roshan, now visible.
Oh, okay, sir. Okay. Yes. I hope I am visible now. Sorry for the inconvenience. Yes, so we are talking about body. If a person is having deficiency or protein, this person will suffer from undernutrition. If it will exceed limits of calories and proteins, then it will show in the form of nutrition, and it is also called as obesity. That normal people is a normal person is there with normal height as per the age, normal weight as per the age, and we have wasting, stunting, that is accompanying the conditions. So globally, 155 million children under the age of 5 suffer from chronic malnutrition. That is also known as stunting or low height for age or low weight for age. Pregnancy and first 2 weeks of life of a child. Irreversible. The chronic malnutrition is actually becoming concentrated in countries with fewest resources, as India is one of the underdeveloped country, or you can say a developing country. So these countries like India or underdeveloped countries or the developing countries have main issue of undernutrition. Am I audible now? Am I clearly audible now? Someone in the chat box was saying that yes. Okay, fine. Then chronic malnutrition is becoming concentrated in the countries with fewest resources, and where 1 in 3 children have stunted growth or malnutrition. Today, 9 in 10 children live in low and lower middle income countries have such an issue. Just wait a minute. Yes. Talking about the global data, where wasting is approximately 45.4 million. In 2020, the wasting continued to threaten the lives of estimated 6.7% of 45.4 million of the children under 5 globally. And stunting is even more regressive, with 149.2 million of the children stunted, and it affected approximately 22% of them. Similarly, overweight is also a condition which is under the periphery of malnutrition, and 38.9 million of the children are overweight. The data which I was talking about was a data sourced from UNICEF, WHO, and World Bank Joint Child Malnutrition Estimates 2021. Moving towards the country specific data, which is sourced from Comprehensive National Nutrition Survey 2016 and 19, it says that 11% of the percent of the children under 5 are acutely malnourished. That is, their MUAC, that is mid upper arm circumference, is lower as per their age, as well as 5% of the 5% of the children under 5 are acutely malnourished. That is absolute MUAC, that is done by absolute mid upper arm circumferences, whereas 17% of the children under 5 are wasted, that is they're having low weight as per their height. 33% of the children are underweight as per their weight, that is to be there according to their age, and that 33% of the children are underweight, and 35% of the children are stunted, that is their height is low as per their age, as well as 2% of the children are overweight, that is their weight is more as per their height. Now, talking about the conceptual framework of malnutrition, this is the conceptual framework that is given by UNICEF and European Union in collaboration in 2014. Firstly, we see that there are some basic causes of malnutrition, which includes inadequate access to services, inadequate financial human resources, and socio-economic political context. Like, for example, inadequate care includes practices such as inadequate breastfeeding or poor dietary intake during pregnancy or in general. Lack of public health services and access to clean water as well as poor sanitation can contribute to malnutrition by promoting environmental conducive to the contraction of disease. Then, moving towards the underlying causes, these have household food insecurity, inadequate foods, feeding and care practices, house environment, and health services. It includes the household food security, that is a lack of reliable access to safe, affordable, and adequate amounts of nutritious food for those in household. Then, coming towards the immediate causes, inadequate dietary intake, and some disease like infection and malnutrition have cyclic relationship, where inadequate diet can cause weight loss and growth faltering as well as lowered immunity, and this will ultimately lead to the increase in incidence and severity and duration of diseases. Then what they do, they lead to the loss of appetite, malabsorption of nutrients. Hello, am I not audible? Am I audible? Yes. I think my microphone is having some issue, so you can just message me whenever I am not audible. I will repeat that thing again. Okay. Yes. So I was telling that infection and malnutrition have a cyclic relationship with inadequate diet. Like inadequate diet will cause weight loss and growth faltering and lead to lowered or impaired immunity. And then when immunity will reduce, then the chances of diseases will increase. And in return, what happens? Right, malnutrition of nutrients and increased need for nutritional requirements will occur. Ultimately, this is a reoccurring process. Again and again, this thing will occur. Then these things will ultimately lead to short-term consequences that are mortality, morbidity, and some kind of disability, or some long-time consequences that is impaired cognitive development, health, and economic productivity. So the ultimate manifestation of poor nutrition is malnutrition due to any basic or underlying or immediate factor. And this condition, the condition of malnutrition can happen because of any of these factors. The immediate cause of undernutrition involve insufficient dietary intake of nutritional foods or any disease which can prevent the absorption of nutrients. So I hope you understand this conceptual framework. Now, moving towards the contributing factors, Some of the factors for malnutrition includes inappropriate dietary choices. Like if it is not necessary that some person is having not having food to feed the child, sometimes it is also the dietary choices which people make to feed the child. If the diet they are giving to the child is lacking in nutrients, then the child can definitely have some deficiencies. It can rather be some major deficiency of protein or some minor deficiency of some micronutrients. Then again, lack of clean drinking water can lead to infections, which can lead to diseases and ultimately to malnutrition. Low literacy of parents, because the literacy of parents or the knowledge of parents regarding what to feed to a growing child is very much requisite, and such things can also contribute indirectly to malnutrition. Then reoccurring infections and weak immunity, as I told in the that immunity and infections, disease, these and malnutrition, it is a vicious cycle. So if the reoccurrence of infection is again and again due to weak immunity, then the child may not be able to take a proper amount of food according to the age of the child. So the child will suffer from malnutrition in longer period of time. Impaired metabolism, supposedly a child is not having proper metabolic rate, so also the child can have malnutrition. Impaired metabolism, this condition include hyperthyroidism, in which basal metabolic rate of the body increases, and it can lead to more calorie utilization by body at resting stage. Like diseases such as celiac disease, in which gluten intolerance is there, or lactose intolerance, it can these conditions can also lead to malnutrition, because whatever, like gluten, if we are feeding to child, cereals we are feeding to child, the child is not able to absorb that properly. And similarly with lactose intolerance, like the child is not able to absorb milk properly, and thus the child can suffer from malnutrition. Then again, uh, poor sanitation and hygiene can be one of the contributing factor for malnutrition, because poor sanitation and hygiene leads to infections and impaired immunity and thus disease. Then there are some basic symptoms of malnutrition. These are not clinical symptoms, but the symptoms which body of a child represent when he or she is suffering from malnutrition. Firstly, the child will feel tired most of the time. Lethargy will be there. The child will not be concentrated and lack concentration, especially while studies or doing any type of focused work. The child will lack concentration. Then difficulty in keeping warm, the body will not be able to organize and manage the temperature of its own due to the problem in the metabolic functions. So the child suffering yes, the slide you can see is of symptoms. Somebody was saying it's not moving. Can you see the slides of symptoms? Anybody in the chat box? No. Okay, wait a minute. Now, okay, okay, fine, fine. Okay. Yes. So, firstly, I was talking about that the child will feel tired most of the time. He or she will lack concentration due to malnutrition, and the body will not be able to keep herself or himself warm because of the impaired metabolic functions. Then getting sick more frequently. As I told you earlier, that if we are having malnutrition, then some impaired due to impaired metabolism, immunity will be compromised. Because of the lack of nutrients, immunity will be compromised. So the child is will be having more chances of getting sick more frequently. Then depression is not as such very sort of clinical depression, but yes, the child will not feel concentrated, and he will not feel energetic. So yes, like every other child of his age group will be playing around, and he will be not able to catch up with those activities. So yes, it can lead to some small depression. Delayed wound healing due to the impaired immunity. The if any like wound is there, then the wound healing function is delayed in due to malnutrition. Then longer recovery every time after sickness, because see, when you are sick, and in case you are malnourished, your body is not properly able to absorb all the nutrients whatever is given to it. So yes, the recovery process is delayed in malnourished children. Then moving towards the clinical effects of malnutrition. See, uh, clinical effects, malnutrition is as such a thing that whole of the body is compromised or suffer because of the effects of malnutrition. So a malnourished child metabolism reduces activity to adapt to the lack of nutrients and energy, and it what it does, it slows down to survive on a limited intake of essential nutrients in order to preserve essential body functions. These changes can affect every cell, tissue, and the whole system of the body. The process of change is called reductive adaptation. The initial reductions do not alter the ability of body to respond to minor changes, but they impair its capacity to cope with stressful conditions as infection, cold, or any intravenous infusion or excessive oral liquids. For example, one example I'll give you here, that what the circulatory system may properly at rest with no signs and symptoms of the child, but it may not be able to cope up with sudden increase of circulatory volume, such as after an infusion or transfusion. Since the physiological responses to the increased volume are impaired, a simple infusion may result in cardiac failure. So these things can happen. Similarly, restriction applies to the digestive system as well. The amount of protein and other nutrients that can be absorbed in one meal is limited. All other body functions like immune system and its ability to respond to function, the liver's ability to detoxify, the kidney's ability to excrete, and hormonal responses are also affected. Like seeing this diagram, as you can see, what happens in digestive system, you can have the malnourished child can have intestinal infections, chronic inflammation, impaired nutrient absorption. Then pancreas, in which way pancreas suffer, what happen, the pancreatic function is impaired, and the risk of diabetes is always there in a malnourished child. Liver loses its function and will not be able to perform to its 100% capacity properly. Similarly, with the respiratory infections, as you know, the mucosal lining is the first lining of defense in our body. So malnourished child, this lining is compromised, and which will lead to respiratory infections. Then decreased appetite is there, lethargy is there, and some long time developmental effects will be there if this condition of malnutrition is prolonged for a certain period of time. Now, loss of muscle mass will be there due to not proper nutrients in the body. Skin infections can be there, and edema can be there. The body can accumulate water, and the water retention can be seen in the foot or extremities of the child. Then kidney function will also be impaired, and immune function will also be impaired. Decreased cardiac output is there, and which causes risk of heart disease. Thyroid gland is also impaired, and it will increase the stress response, and growth hormone regulation is also impaired. Now moving towards the pathophysiological details. In this, we will learn which system of the body is compromised in which manner. Like firstly, talking about the immune system, increased risk of sepsis will be there. Sepsis is like infection, and the body is not able to respond properly to any sort of bacterial viral infection, and this condition increases when the malnourished child is accompanying with the problem like hypoglycemia or hypothermia. Hypoglycemia, as you know, is the low glucose level in the body, and hypothermia is low body temperature. So if these two conditions are there in a malnourished child, then the risk of sepsis will increase in the child. Then the lymph glands and tonsils and the thymus are atrophied in a marasmic child. Decreased cell mediated immunity, like T cell immunity, will decrease, and IgA levels in cessations. Competent levels. Phagocytosis, decreased acute phase immune response. Typical signs of infections such as leukocytosis and fever are frequently absent. Like in a normal person, what happens when our immunity is compromised? The first sign and symptom which our body show is fever. Basically, the temperature of the body increases in case of an infection, bacterial, viral, any infection. But in a malnourished child, what happens? The typical signs of infection will be missing. Like you won't be, the child will be suffering, malnourished child will be suffering from some kind of infection. The body will not able to showcase it through first sign and symptom, that is fever, that is absent in a malnourished child. Then some other inflammatory mediators are also there, that is in kwashiorkor. Then moving towards the liver, in liver, what happens in a malnourished child? The synthesis of albumin is decreased and the glycogenosis process is decreased, and it will increase the risk of hypoglycemia, that is reduced glucose in the body. Now moving towards the urinary system, what happens? The globular filtration rate will decrease and it will again give a chance of the body to have uterine infections, which is very common in case of malnourished children. Endocrine system is also compromised because of decreased insulin production in the body, as well as the growth hormone is increases, but the insulin like growth factor is reduced, and this is due to the downstream effect of the increased growth hormone. The cortisol levels of the body is also increased. Now cardiovascular system is also compromised, and especially what happens, the cardiac output is decreased and stroke volume is also there. Endometrius malnutrition results to fragile fluid imbalance. The body of a malnourished child generally is not able to keep up with the proper fluid balance in the body. Gastrointestinal tract is also compromised, and the level of gastric acid secretion of small nutrients there. Like, as you all know that we absorb nutrients from the food through our small intestine. So malabsorption of nutrients is there in case of malnutrition. Loss of intestinal barrier function is also there. Intestinal barrier function is very much necessary if a person is having food and any infection is there in the food, like any bacterial contamination is there in the food. Like in case of foodborne diseases, we see that the infection is through food. So in that case, the intestinal barrier plays very important function, and in case of malnutrition, the loss of intestinal barrier is also there, so the child is more prone to have foodborne infections. Then skin, atrophy of skin is there, and loss of subcutaneous fat is there. Signs of dehydration are unreliable. Actually, what happens in the malnourished child, as I told earlier, then that edema is there. Because of that, the body is not able to keep up with the fluid balance in the body of a malnourished child. The body, what happens in the body, some water retention is there. So by seeing those kind of child, you will not be able to understand that the child is suffering from malnutrition, because at one sight, at one look, the child may be looking healthy, but this is just just the water retention or edema. So the signs of dehydration are not very unreliable. You will not be able to see that the child is dehydrated at first sight. You have to look for clinical signs and symptoms. Then metabolism is also compromised, with the risk of hypothermia in the cold environment and hyperthermia in the hot environment due to impaired heat generation and heat loss. Decreased basal metabolic rate is there, but what happens? It increases during the recovery period. Now, this is the strengthening integration of nutrition, that is commissioned by EC, European Commission. It is they are just telling a cycle, that in what cycle what happens. Like firstly, if a child is low weight at birth, or a preterm baby that is born prematurely, then there will be impaired mental development, inadequate growth, and frequent infections if the child is not looked after properly. And such children are often stunted, and they have reduced learning ability as well. Then a stunted child will grow into a stunted adolescent with a reduced learning ability. And such stunted adolescent girls will lead to small pregnant women, which will carry greater risk of developing chronic diseases such as heart diseases, hypertension, and diabetes. So these mother will ultimately produce babies which are low birth weight, because such mothers will have birth complications, interuterine growth restrictions, and maternal mortality or morbidity. So this is a cycle which is telling us that if a child, if a low birth weight baby we have, and if a preterm baby we have to take proper care of the nutrition of that baby, and proper care of diet and diseases for that baby, so that further the baby will grow into a healthy individual. Now, this slide shows the cost of malnutrition. As we see that this topic, malnutrition, is across globally, it is noticed now, and like from decades, it is noticed, and still we are suffering from the problem of malnutrition. And it is not that it is only the physiological process, or a physical process through which a child development is restricted. It also costs us physically, financially as well. Like adults who are undernourished as children, they earn at least 20% less than those who are not. This is not the data which I am saying, just saying. This is sourced from Global Nutrition Report 2014 by FAO. So undernutrition and micronutrient deficiencies, that these deficiencies cost. Okay, okay, sorry, I'll try. Hmm. Hello. Hopefully now it's fine. Am I audible? Anybody in the chat box, please respond. Yes. Okay, fine. Thank you. So yes, undernutrition and micronutrient deficiencies can cost up to two $2 trillion per year. This is a global data. And child and maternal malnutrition is by far the largest nutrition related health burdens in the world. The cost of treating overweight or obese is equal to 4 to 9% of the most countries' GDP. The cost of obesity and overweight related non-communicable diseases was estimated as 1.4 trillion US dollars in 2010, and by 2030 the global decline in productivity due to illness and death from NCDs will reach to $35 trillion. Asia and Africa lose 11% of uh, gross net profit every year owing to poor nutrition only. And malnutrition in first 2 years of life reduces the education potential of children as well. So proper nutrition is not only responsible for physical development of, but it also gave a nation a stable livelihood, a stable future ahead. Nutrition is one of the best investment which a person can have in the child. Like cost benefit analysis of the nutrition interventions report, that is a return that is 18 to 1% per child. That is the return, that is the cost benefit analysis of a nutrition intervention. And it is said that with adult height, a 1 centimeter increase in stature is associated with 4% increase in wages for men and 6% increase in wages for women. So nutrition is just not the physiological complication or a physiological term to be physiological factor associated thing. It is also, it costs us as a nation a lot. So it needs to be looked forward properly. Now moving towards the categories of undernutrition. Okay. So these are what? These are basically the parameters through which we assess that if a child is developing normally or not. Firstly, if the child is having normal height for age, weight for height, or BMI, MUAC, then the child is definitely into normal category. Then we have wasting. Wasting is termed as low weight for height. If for your height, your weight is in proper category, then then it is said that you have normal, you are normal. But if it is not, then you can a child can be having severe, moderate, or mild wasting. Same goes with stunting. Stunting is termed as low height for age. Like for a particular age category, if the child is low in height, then looking towards the WHO growth charts, we can see that the child is suffering from severe stunting, moderate stunting, or mild stunting. Then comes underweight. It refers to low weight for age. Like if the child is not growing its weight as per the age of the child, then the category is known as underweight. And this can also be of three categories like severe, moderate, and mild. See here, I have shown you this bell curve because this is the basic of how we categorize severe acute malnutrition, mild malnutrition, and normal category obesity and overweight and things like that. Here, as you can see my cursor moving, I hope it is visible. Firstly, in the mean, where 0 is there, this is the mean height or weight for age of any person that is in a normal category, that most of the person will be having most of the population will be having weight around or height around this mean. This is normal. Okay, when we move to -1, -2, -3, as you can see below in the graph, these are standard deviations. Okay, so if we are moving from 0 to -1, okay, and 0 to +1, this category is called as normal. For weight, for height, for weight for age, for height for age, for weight for height, or any parameter. If we talk about, if the child is ranging between -1 to 1, then the child is termed to be as normal for that particular parameter. Okay, then moving towards left side, if the child is ranging from -1 to -2, means the data of the weight of the child or the height of the child or any parameter will range from -1 to -2 standard deviation, then the child is suffering from mild form of malnutrition. It can be stunting, wasting, underweight, or any parameter. Then moving towards the periphery more, if the child is between, the data is between -2 to -3, the child is suffering from moderate form of malnutrition. Then again, if the data of the child of any parameter is below -3, then the child is suffering from severe case of malnutrition. So this bell curve is actually the parameter or the basics how we categorize the severe, moderate, and mild cases of malnutrition, and this is the basic curve for assessing stunting, wasting, underweight, MUAC, skin fold thickness, and for all the other parameters, this same distribution is used. Now, indicators of undernutrition. As we have discussed further, I'll tell you more about it. Firstly, stunting, which is very much prevalent now across globally, across globe. Stunting is also known as low height for age. If a child is not, the height of the child is not increasing as per the age it should increase, then it is called as stunting. And like stunting, what are the factors for stunting? Chronic malnutrition. It is not that the child has not eaten for 1 month or not had properly taken diet for a month, so he will be stunted. No, it is chronic malnutrition. It is the effect of chronic malnutrition through several years. When the child is not having proper nutrition, then only this problem is seen, the stunting is seen. Prolonged food deprivation or disease will also lead to stunting. Then underweight is, it is a combined indicator to reflect both chronic and acute malnutrition. how it is assessed? It is assessed by low weight for age. If the baby's weight is low as per the age, then the category is known as underweight. It can also be chronic as well as acute. Like for example, I can say that if in a month a child is not having proper nutrition, so yes, the weight will be stable, it will not increase and it can decrease as well. So it is a acute indicator of acute malnutrition. As well as for longer of period of time, if the child has not taken proper nutrition, so yes, this parameter is again indicator of chronic malnutrition as well. Then talking about let's move to wasting. Wasting is low weight for height. uh, it is when the weight of the child is not as per the age, sorry, as per the height. It is also showcased in case of acute malnutrition and recent food deficit or disease. Like for example, a child is well grown in terms of height, and yes, the weight of child is not growing properly or is restricted. So what we say that due to acute malnutrition or recent times the child was not having proper nutrition, so in that case the weight has not gone up and it has reduced to some extent. So this is known as wasting. Now, these are the cutoffs given by WHO. WHO is an organization which provide cutoffs for children to 0 to 5 years. Indian Academic of Pediatrics is there. We generally follow the data, the cutoffs of IAP, but IAP has not given cutoffs for 0 to 5-year old children recently. The cutoffs are very old from for IAP, like 2000, 1990 or 2000. The data is for IAP. So we generally don't use the cutoffs given by IAP for the children weighing for aging for 0 to 5 years. IAP cutoffs are used for children from 5 to 18 years. So WHO have made this cutoffs, or you can say these standards on the basis of data they have collected from India as well. So we generally use the data, the cutoffs of WHO or the growth charts of WHO. So here you can see the measure and the severe and the moderate case of malnutrition. Like stunting, as I've shown in the bell figure, you have seen that minus SD, if the child data is less than -3 standard deviation, then severe form of stunting is there. And in case the data is between -2 and -3 standard deviation, then it is moderate. And similarly, you can see in all the cases the same is there. In MUAC, absolute MUAC, we can do for two types, like MUAC, mid upper arm circumference, um, uh, for age we can do, and MUAC absolute also we can do. So these charts or growth charts by WHO are given. So in case of absolute MUAC, severe undernutrition is there in case the arm circumference of the child is less than 115 mm. And if it is between 125 to 115 mm, then it is moderate malnutrition. Yes, moving towards these categories, like we have moderate acute malnutrition, as I told, and severe acute malnutrition, and one term is introduced now, that is global acute malnutrition. Okay, so what is there in moderate acute malnutrition, which like as we discussed in the earlier slide, if the weight for height Z4 it is between -2 but more than -3, like between -2 and -3, then it is termed as moderate acute malnutrition. Similarly, in case of SAM, this also known as severe acute malnutrition, MEAC should be less than 115 mm or 11.5 centimeter. Weight for height Z score should be less than -3. Bilateral pitting edema will be there. This I will explain in coming for further slides. Marasmic and kwashiorkor, both wasting and edema, can be seen in these cases. Now, this term has been introduced by WHO, that is global acute malnutrition. It is basically both sum up of both the categories of MAM and SAM, and the sum up of prevalence of SAM plus MAM and the population level. It is a global term which is now able to represent malnutrition on whole. This is the categorization for SAM, severe acute malnutrition. Okay. So here SAM is actually of two types. Severe acute malnutrition is of two types. One is with complications and other is with not complications. No complications is there. I'll tell you what is the difference between the two. Age of the child should be more than 6 months to 5 years. Okay. And MUAC should be less than 115 mm it is actually, or bilateral edema is there. So what happens, the child with no complications of SAM, severe acute malnutrition, will have a good appetite at first hand and will be clinically well. Infection, it can be there, but it will be mild. Okay. And diarrhea with no dehydration, like, yes, these are the examples. Now, pneumonia will be there, but not very severe. Diarrhea can be there, but without any dehydration. This is SAM with no complication. And SAM, severe acute malnutrition with complication, will have, the child will have definitely a poor appetite, or the child will not be clinically well. For example, the child will have severe pneumonia or diarrhea with dehydration, or any of the danger signs as well. Now I will talk about appetite test. What is appetite test? Appetite test is actually very important criteria to differentiate between the complicated case of SAM from the uncomplicated case. Children with SAM and poor appetite are at immediate risk of death. And specific in what happens in when we do an appetite test, what we do, we actually give a small amount of ready to use therapeutic food or any other therapeutic food which is used locally. It is given to the child according to their age. The amount of the food, such food is given to the child, and they have to finish eating that amount within a specific duration of time. If the child is not able to completely eat that food in particular duration of time, that means the child is not having a good appetite. And if we give proper food also to the child, malnourished child, he or she will not accept that food, and her or his body will not accept the food, and the food will not be ingested properly as well as taken properly from the body. So, good appetite is very important for a malnourished child. In case the child suffering from malnutrition is not having a poor appetite, then Anganwadi workers or asha workers definitely should refer such child to hospital, because if the child is having poor appetite, he or she is not able to feed properly on the food. If you give to that child, he or she will not be able to eat that food properly. So again, the problem of malnutrition will prevail, and the in case of infection or diarrhea will become more severe. So in that case, it is told that the community health workers or the Anganwadi workers should refer these child to a proper healthcare facility. Okay. Thank you. Today, actually, we are covering this much, and in the next session, I will be covering the tools and how to use those tools properly to categorize malnutrition and to detect malnutrition. So these tools we will be talking in next session, that will be in coming Saturday. Okay. Thank you. So you can ask your questions. I hope I am audible to all. Am I audible?
Yes, Roshan.
Yes. Okay. So, in the chat box, please ask any questions if you have regarding the portion which I have covered today. Yes, one question is there. I can see. What are the? Okay. What are the? Oh yeah, what are the advices for low birth weight to gain weight? Okay, okay. See, a low birth weight baby, firstly, they are into proper healthcare facility till the doctor is assured that such babies are safe from infections and are safe enough to thrive in a proper environment. They won't discharge such babies. So a baby, if the baby is low birth weight, they will be taken care by the hospital, and they will be given some apart from the breast milk, some formula milk can also be given by the doctors to such babies. Then again, when these baby will come home, then breastfeeding is very essential for such babies. And after 6 months, complementary feeding is a must. For example, complementary feeding, many mothers don't have proper information how to move from breastfeed to proper diet that is given to a 6 month old or 7 month old. Okay, what form of nutrition can be given? Because like low birth weight babies, sometimes what happens, these babies bodies are compromised, and such babies can have some digestive issues as well, and their bodies may be not able to take a food properly. So the mothers should consult a doctor, and they should consult them, and the anganwadi workers should consult them, that whatever food they are giving should be easily digestible, properly cooked, and especially the foods rich in vitamins, minerals, providing immunity to a child should be given. Like in case we say that mashed apples, poached, steamed apples, mashed apples, that can be given. Such kind of mashed bananas can be given. And apart from fruits, for maintaining the electrolyte balance, you can give coconut water as well. And malted foods are very good for the child, especially in complementary feed. So like malted ragi, that you can prepare a porridge and give to them, and things like that, that are very easily digestible with negligible amount of fiber, is important for low birth weight babies to gain weight. So taking consideration the dietary fiber that is going through the food, taking in consideration the digestibility of that food component, it is very important. These factors are very important. So these babies will definitely grow with weight. Yes. Again, question. Are you satisfied with the answer, or you want some more details? Any other questions? And I would like to add in that if we see, you people are dealing with people that are in community, so you can also guide the mothers and tell them that the child's immunity is also compromised, in especially the child is low birth weight and malnourished. So what they should give boiled water to the child. So these small things will keep the child to have a better immunity. Like the child will not catch infection and again. So the body will be able to come up and pave up this problem of low birth weight and malnutrition properly. So these important things to keep up with the proper cleanliness around child, and the proper clean drinking water, proper sanitation facility, that is must around the house, that is must in the household. Any other question? I will wait for 5 minutes. you. Now, please repeat about the management of malnourished child with poor appetite. Yes, yes, yes. Okay, sorry, I haven't seen it yet. Yes, if the child is in severe acute malnutrition, suffering from severe acute malnutrition, and is having poor appetite, then first and foremost thing which a Anganwadi worker should do is to admit that child into a healthcare facility, because by any means these problem cannot be solved out at home. What doctors do, doctors will give several ready-made, several ready-made therapeutic foods are there, made up of rice gruel and things like that. They will provide several amount of that to the child. Particularly, they will continuously monitor the hydration level of the child, and will give medicines to fight the infections. So what is there, every district hospital, government hospital, has a sam care facility. Yes. So these such children with SAM and with a low appetite or poor appetite should be admitted to such SAM care facility. And after that, when the child is having proper appetite, they will just keep the child under proper supervision. They will look after to him. They will give proper diet to them, and they will give proper medicines to them to fight the infections. And when they see that the child is now having, yes, the child is still severe acutely malnourished, but the child is having a normal appetite and is ready to go home with less amount of infection, so they just discharge the child from there. Okay. So first and foremost thing a Anganwadi worker or a community health worker should do is to refer that child to a healthcare facility center. These facility centers are available in every government hospital, especially for SAM babies. Shall we classify which is development under SAM? If they show all the categories, shall we classify the children? Anomalies? Okay. Yes. Ma'am, what is there? SAM is generally categorized in two forms only. See, developmental anomaly, yes. If the child is height is less as per age, you can say that the child is stunted. Okay. Okay. If the child is having weight for age, less weight for age, then it is underweight, the child is underweight. But severe acute malnutrition can be said if the child is under any three category. Okay. Like if the child is having low weight for age, low weight for height, any category, MUAC, if the child's MUAC is less than 115, any category if the child is under, then you can classify that the child is under a severe acute malnourished category. If all the categories are positive, then the child is definitely under very severe form of malnutrition. Okay. Then if the child is under very severe form of malnutrition, then we look forward for the appetite test, that the child is having proper is taking proper food or not. If the child is not taking proper food, then the healthcare facility is the only option. Any other question? Any other question? Repeat about the management. Okay, management of malnourished child with poor appetite. Okay, okay, okay. I hope, Jyoti, you understood that the child with SAM child with a poor appetite should be directly addressed to a healthcare facility, because at home there is no such option for such children. Because if you, whatever you provide to that child, he or she will not be able to take it properly, he will not eat properly. So because infections are very much prevailing in the body, dehydration is very much prevailed in the body, so these child should be admitted to a healthcare facility. Yeah. Any other question? Thank you. Yes, one more question. The children who are taking milk on empty stomach, there can be decrease in appetite. Decrease in appetite. Actually, what it is like, see, for 0 to 6 months, milk is only one food which a child is having. Okay. And I have taken your session on breastfeeding. So it is said that you can have 8 to 10 feeds a day. Okay, fine. Now, when you shift to supplementary food, okay, the milk is not the only and primary source of nutrition to a child. Okay, so we say that uh, like in between meals you can give milk, you should give milk properly, but yes, the food should be the proper a proper amount of food, and as advised as per the age, should be given to the child in the proper meal timing, so that the child will develop a schedule as well. The body will also optimize its way to that, because it is not as such that if taking milk in empty stomach it will decrease appetite. It is not as such, but the child's body, everybody's bodies is designed as such that if you give a meal, proper meal at the time of meal, like in morning you give a proper healthy small breakfast to that child which is easily digestible, then a proper lunch in which you can include some fruits and some gruels, porridge and things like that, and dinner also. In between the meals you can give between you can feed the child will 1 or 2 or 3 times, 4 times you can feed milk to the child. So the child will develop a proper schedule, a healthy schedule, and in such way the appetite will also be normal. Actually the child's body will be able to receive food, because when we start supplementary feeding, the milk is not only the primary source of nutrition for a child. So we have to make a child body to understand that now food is the primary source of nutrition to you, and milk is somewhat supplementary now to you. Okay, so yes, basically with the progression of time, the body's ability to uptake milk, digest milk will also decrease. So it is not that you should not give milk on empty stomach, it will decrease appetite. It is not as such, but I suggest that you should give meals in proper timing to a child, and milk will be given in the hours between, like as a frequent munching thing or things like that. Okay, any other question? In the next session, we will discuss about the screening tools and how to use them properly, and will relate to the indicators of the malnutrition. Okay. Any other question? I will wait 1 2 minutes more. Okay, then if there are no more questions, I think I will just end this session. Thank you so much.